Hello there, my name is Justin Brock, and I am a Medicare agent, have been for about 7.5 years. My father was also a Medicare agent. He started in 1992, and we run a Medicare office, a Medicare agency in Tupelo, Mississippi, where we educate people on their Medicare choices daily. We have a team of about 18 staff members, both administrative or client services, as well as agents that can help our new customers and existing customers navigate all the challenges that Medicare beneficiaries face. In the duration of this video, I'm going to take the time to explain Medicare choices in a way that I hope proves to be extremely easy to understand and cuts through a whole lot of confusion that people tend to have when they become Medicare eligible. There's two logos on the screen that you'll see here. It's the Medicare Gurus Community as well as Bobby Brock Insurance. My name is Justin Brock. Bobby Brock Insurance. Bobby Brock was my dad's name, and that's how we marketed in the local area for a long time. And as we started to serve the Medicare or boomer community around the country, we decided we wanted a name that maybe put out there exactly what we were about, and we're about being your Medicare guru. We want to take all of the questions that you have and answer them, and that's what I intend to do in this video. You can see a picture on the screen now of my team. We are very, very excited to be able to help you with anything that you need in the Medicare health insurance retirement transition gauntlet. Thank you for watching. I hope this is helpful. Okay, 2021 Medicare Educational Seminar. We do this seminar in person about once a month in various towns. We travel around and do that. We'll do it 2 to 3 times a month, but in one location, normally 2 or 3 nights in a row. But some people, because of COVID, want to get out and get this information virtually because don't want to subject themselves to anything unnecessary. So we want to do it in the comfort of your own home. So the 4 things we're going to really dive into are enrolling in Medicare, the parts of Medicare, Medicare risks, and Medicare options. Original Medicare. Are you eligible? So you become Medicare eligible when you reach the age of 65 or when you've been declared disabled due to certain disabilities, or if you're diagnosed with end-stage renal disease, that's stage 5 kidney disease. Enrolling in Medicare. If you haven't enrolled in Medicare or you need to enroll in Medicare, there are typically 3 ways aside from going to your local Social Security office. One is online right there at ssa.gov/retireonline. Second is to call 1-800-MEDICARE. And the third is to call the Social Security hotline number 1-800-772-1213. If you can go to your local office, sometimes that is also as helpful, or we can help you do this as well. Enrolling in Medicare continued. If you are on Social Security, you will be automatically enrolled in both Parts A and B. You don't have to keep either one of them, we'll get into later, but you will be automatically enrolled if you're drawing Social Security. If you're not on Social Security, you must actively enroll yourself, so you have to call or go online to enroll yourself. Enrolling is easy. Just go to the Social Security website. You can enroll in about 10 minutes. Your initial enrollment period is 7 months. That's 3 months before your birth month, and 3 months after. Okay? 3 months before, the month of, and 3 months after. That is your initial enrollment period. Okay, so what if I plan on continuing to work past 65 and not take Part B? This is an extremely common question. It's something a lot of people face, and it's what gets us a lot of traffic on the internet, people Googling this question. So some workers will enroll in Part A and not Part B, where the employee health plan is still in force. So if you plan on continuing to use your group health coverage, you can. Typically, you would still enroll in your Part A, and you would just defer Part B until you decided to retire and then lose coverage. You check with your employer regarding the option. Your HR department should be able to help. When your employment ends, you will want to activate Part B. At that point, by activating Part B, you will have a 6-month window to sign up for any Medigap plan you want. You'll have an open enrollment period is what they call it for Medicare Supplements. What if I plan on continuing to work past 65 and take Part B? So if you decide to take Medicare Parts A and B and you keep your group insurance past 65, you will have a 63-day guaranteed issue window to sign up for a Medicare supplement without medical underwriting once you do retire. That's called a special enrollment window for losing eligible coverage. So you can also then activate a drug plan or something like that. There are some situations where Parts A and B are in force. Your employer's health plan will pay the remainder of the costs. So just look at it again. If you have an HR department, sometimes they can help on deciding whether your employer plan needs you to have Part B or doesn't need you. Most of the time, it seems like if you're going to keep the group coverage, you would want to stay off of Part B and just have Part A. Group versus Medicare. Here's the things to consider when deciding whether you want to go on Medicare or just stay on your group plan. The premium, the overall cost. If your group is free, it doesn't cost you anything. That can be a huge factor in it. You want to consider the deductible. If you have a $5,000 group deductible or a $2,500, there may be some ways on Medicare you can have a lower deductible. Co-insurance percentage, so if it's 70-30 and Medicare is 80-20, there's just some factors there. Maximum out-of-pocket cost. A lot of times group plans have a maximum out-of-pocket. It can be low, can be higher, $5,000, $7,000, but sometimes it's lower, $2,500. It just depends. As well as co-pays. So if your birthday is between the 2nd and the 31st, your Medicare will go into effect the 1st of the birth month, okay? But if your birthday is on the 1st day of the month, then your Medicare will start the month prior to your birth month. Medicare Part A, okay? We're going to dive into Part A first. If you see the Medicare card here, the Medicare card has a Part A and a Part B on there. It says hospital and medical, and it has a start date for each, right? So Medicare Part A, for each benefit period in 2021, I got an extra 1 on there for some reason. Days 1 through 60, you have a $1,484 deductible. Now you could have to pay that deductible twice in 1 year, or multiple times in 1 year if you were admitted for separate causes or outside of that 60-day period. If you're readmitted within 60 days for the same cause, you typically don't have to pay that deductible again. Days 61 through 90 of hospitalization, you would pay $371 per day. Days 91 through 150, you could pay $742 per day. After days 150, you could be subject to all costs. Now again, some of these numbers can look crazy, but we are going to talk about ways to limit those as well. But Medicare Part A by itself covers hospitalization, and those are the amounts that with it only you would be subject to. Medicare Part A, paying for skilled nursing facility. So skilled nursing care is also covered under Part A. Skilled nursing is like a sling bed or rehabilitation center. This is for people that say they have osteoporosis and they broke their knee and they need some enhanced healing, so they need to go into a skilled nursing facility to have round-the-clock care to make sure that they heal up properly. Okay, so days 1 through 20 with Medicare Part A, you don't pay anything. Days 21 through 100, you could pay $185.50 per day. Days 101 and beyond, all costs you'd be subject to pay all the remaining costs. Again, we'll talk about ways to mitigate these costs here shortly. Costs for Part A continued. No premium is required if you paid Medicare taxes for 40 quarters. What does that mean? If you worked for 10 years and paid your Social Security Medicare taxes, you're not going to pay a premium for Part A. It's free. You wouldn't have to pay anything for that. That's most people that we come in contact to. Occasionally we have someone who maybe migrated here. I've had like a client, for instance, who's a cardiologist in town, and he's originally from India, and he brought his parents over, and they wanted Medicare, so they pay for Part A to get access to it. If you paid Medicare taxes for $39 or 39 quarters or less, the standard Part A premium is $240. If you paid for less than 30 quarters, it's $437. So if you have more questions about Part A premiums, you can let me know. Medicare Part B. So three little easy breakdown of Part B is the premium is $148.50 per month. That's the standard premium. If you're filing jointly, tax filing jointly, and you're under 100 and I think we'll come to that, under $176,000 a year in income based on 2 years prior income, you will pay that premium. People over that can get into a higher premium chart. So we have a premium chart here. I'm not going to go through every single number, but if you're over that, we could break down what your premium would likely be. Deductible, again, we misprinted it there, but the deductible is $203. It says $20. It's actually $203. It's a one-time annual deductible of $203 right now in 2021. Last year in 2020, it was $198, so it did go up about $5. And then on Medicare Part B, you pay 20% of all costs past the deductible. 80% is paid by Medicare, you're paying 20%. Again, that 20% can be really big over time, but we're going to talk about ways to mitigate that cost. So, Medicare Part B premium, if you are on Social Security, your Part B premium will be withheld from your Social Security check. If you are not on Social Security, you will receive a quarterly premium notice from Medicare to mail in your Part B premium. You can, if you're not on Social Security and you want to pay it on bank draft, you can call them and set it up on bank draft once you get your quarterly bill, and they can put it on a monthly bank draft. So your Medicare coverage choices. When we look at it, we just looked at original Medicare Parts A and B because that's naturally what people get, but you do have some choices to make regarding cost mitigation and drug coverage, as well as some other additional benefits. On one side, you have original Medicare. Original Medicare Parts A is hospital insurance like we just talked about. Part B, medical insurance. You could keep that. That's your red, white, and blue card Medicare. You can get a Medicare Supplement insurance policy or a Medigap policy, and you can add a Part D prescription drug coverage. It rounds it out to one way. The other way is Medicare Advantage, which is also referred to as Part C. This combines A and B into one plan and usually includes the drug coverage with it and may offer additional benefits not provided by original Medicare. Now, there are pros and cons to each, and that's what we're going to dive into here. So first of all, choosing your hospital and doctors. With a Medicare supplement policy and original Medicare, you can go to any hospital, any doctor, anywhere in the U.S. that accepts Medicare without being referred. So that's obviously a pro to staying on regular Medicare and getting a supplement, is being able to go to the doctors and hospitals that you want. So as we look at the supplements, first we're going to break down the three commonly purchased supplements, okay? This is all of the Medicare supplements with the exception of a couple of higher deductible options. And it kind of goes through the basic holes in Medicare on one side and tells you which holes are covered by each of these plans. The three most common plans are plans F, G, and N because they do the best job in filling in all the holes, okay? So here are the breakdowns in the three different plans. First, we'll talk about Plan F. Now, as you see, it says Plan F, new sales discontinued. So what happened is Plan F was made not eligible for sale to someone who was newly eligible to Medicare after January 1st, 2020. So if your Medicare started January 1, 2020 or later, you weren't eligible. If your Medicare started before that, you can keep a Plan F, and you can also purchase a new Plan F if a company has one available. But people who are new to Medicare after January 1st, 2020, Plan F is not available. Now, I will tell you really quick, Plan F was a plan that covered all of the holes in Parts A and B of Medicare, meaning if you had that plan, you had no deductible, no co-pays, no co-insurance, nothing. You can go to any doctor because it's a Medicare supplement, and everything's paid for. So, Plan G is now the Cadillac plan for people who are new to Medicare after January 1st of 2020. Plan G works like this. The Part A deductible It's $1,484 and for each benefit period covered, right? It covers that. The Part B coinsurance is 20% with no cap. Plan G covers that. The Part B excess charges are 15%. The Plan G covers that. The only thing that is not covered by Plan G, the only hole in Parts A and B that is not covered, is the Part B deductible, which is that one time per year, $203 deductible. Okay? A Medicare Supplement Plan G with Company A has the same benefits as a Medicare Supplement Plan G with Company B. In the Medicare Standardization Act that they passed several years ago, they made all of these plans have letters in about 48 states. All the plans have a letter, so if it's a Plan G, it's the same coverage with Company A as it is Company B. The only difference is how much they're charging you. You have the same access to doctors or hospitals and the same exact benefits. Medicare Part D prescription drug coverage. Well, we can help you create a personal profile on Medicare.gov by entering your prescriptions in pharmacy of choice, which will show you your plan options. Enrollment during your initial open enrollment window, 3 months before your Part B effective date. So that's going to be the time that you would typically enroll in a drug plan to get it started by the month that you turn 65. Your annual election period is October 15th through December 7th, and those changes become effective January 1st. So every year you can shop your drug plan between those years because sometimes there are drug plan changes for sure. It's important to review your prescription plan each year because if you don't, you could spend hundreds if not thousands of dollars more than you should during the upcoming year. So this is a Part D monthly premium chart. Most people are going to pay a standard Part D premium, which ranges from about $8 a month up to about $80 a month. Those premiums depend on what drugs you're taking, what pharmacy you go to, all of that kind of stuff. We pick a plan based on that. Now, if your income is over a certain amount, typically around $176,000 for filing joint or $85,000 filing single a year, you can pay an additional premium, which is referred to as an IRMA, income-related monthly adjustment amount. They use the same numbers to choose who has to pay this as they do for Part B, the Part B premium chart that we saw earlier. This chart is a little bit less though. You have around a $12.40 adjustment if you're making over $176,000 or $85,000. So it's just a smaller increase. But if you're under those $176,000 or $85,000 marks a year, you don't have to worry about paying those additional premiums. Prescription plan stages. So in the prescription drug plans, there are 4 stages, right? There's the deductible, and so your plan may have a deductible. Sometimes they don't apply that deductible to your low-tier medications, but most of the drug plans now do have a deductible, typically around $200 to $445 per year. It's a one-time per year deductible, and again, most drug plans will not apply that deductible to just generic, tier 1 and tier 2 medications. After the deductible is met, or if it's waived because of the tier medications that you're taking, you go into the initial coverage phase. This is when you just have a standard copay depending on what tier it is. So they have normally 4 or 5 tiers of drugs. Some drug plans even have 6 tiers, and your copay is subject to what tier that drug falls in. The coverage gap, also known as the donut hole, is the 3rd phase. This is a point where if you spend an exceptional amount on drugs throughout the year, or your plan does, or the combination of you do, you will enter a donut hole where your coverage falls off a little bit and you're having to pay 25% of the cost of your brand name medication during that time. There's another period where if you you incur enough expense for your drugs, you enter a catastrophic phase, and then you're only paying 5% of the cost of your drugs. Of course, on some of the drugs out there, like Revlimid or some of these really, really expensive medications, 5% can still be a lot, and you've probably incurred a significant expense leading up to that. It is important to note that only about 19% of people in the country actually hit the donut hole each year, so it's not everyone, but the ones who do normally talk about it because it is a real pain point for those people. Thankfully, we do have some workarounds to help people out when they incur those massive expenses, as well as some plans that could help, prevent being out of pocket in certain cases. So, Part D late enrollment penalty. The cost of the late enrollment penalty depends on how long you went without Part D or credible prescription drug coverage. Medicare calculates the penalty by multiplying 1% of the national base premium, which was $32.74 in 2020, times the number of full uncovered months you didn't have Part D or credible coverage. So it's 1% times a month, but it's capped at 10% per year. So just to give you an idea, if you had 1 year uncovered, that would be a 10% penalty on $32.74, which would be around $3.27 per month added to your cost. That can get pretty expensive over time. We think the late enrollment penalty is probably one of the less burdensome problems with Part D. One of the most burdensome is that if you go uncovered and you pick up needing a really expensive drug mid-year, you don't have coverage for it and you have to wait to get a drug plan until the next fall election period. Your Medicare coverage choices. So heading back here, we have back where we're talking about now that we went over supplements and drug plans. That plan G that we went over there, plus a Part D plan, would typically be something you would add to your Parts A and B to get you a good setup there. The other option, of course, is Medicare Advantage. Okay, so Medicare Advantage plans are run by private insurance companies approved by and under contract with Medicare. So there's normally not, anymore, maybe originally was some fly-by-night companies getting into the market. For now, it's mostly large companies and hospital systems that are participating in these. So most of your large Medicare Advantage carriers are United Healthcare, Humana, WellCare, Aetna, Anthem or Blue Cross, those types of companies. They provide coverage for your Part A and Part B, but can charge different amounts for certain services. Okay, they may offer extra benefits: dental, vision, hearing, over-the-counter prescription benefits, or over-the-counter like vitamin benefits, gym memberships like silver sneakers, things like that. Costs for items and services vary by plan, but you can have copays and co-insurances on these Medicare Advantage plans until your MOOP, or maximum out-of-pocket, is met. Those maximum out-of-pockets range a lot depending on what area you're in, but we've seen them from as low as $1,000, or maybe on a dual eligible plan even being $0, to as high as $7,000 to $10,000. So it just depends on what's available for you. You still pay your Part B premiums. So in addition to your Medicare Advantage plan premium, which often is $0, you still have to pay that Part B premium, which for most people was around $145 a month. So some plans do have a Part B give back, where they will give you some of that money back depending on the plan. So open enrollment each year, you can shop your Medicare Advantage plan if you want to, just like you can your drug plan if you have a standalone drug plan. But on the Medicare Advantage plan, they normally include the drug coverage, and you can shop that October 15th to December 7th with a changeover date of January 1st each year. What do I need to know about Medicare Advantage plans? The two most common types of Medicare Advantage plans are HMOs and PPOs. An HMO requires you to go to their doctors and hospitals, healthcare providers, unless you have an emergency. You may also have to get a referral from your primary care doctor to get tests or see other doctors and specialists. In a PPO, or a preferred provider organization, they will usually give you better cost sharing if you do stay in the network, but you do not need referrals, and you can go out of the network if you want to. Medicare savings programs. You can get help from your state paying your Medicare premiums. In some cases, Medicare savings programs may pay your Medicare Part A, Medicare Part B, deductibles, co-insurances, and co-payments, and even drug costs for you, depending on your income or certain other factors. Veterans, if you're a veteran, you kind of have a couple of options. You can go Part A only, not pay for Part B, and use the VA for everything. Some people like to use the VA, but they want access to other hospitals and doctors as well. They don't want to be confined to only the VA or to the VA's outsourcing programs because those can be a little slow sometimes. On option 2, you can get Medicare Part A and B and either get a Medicare Advantage plan or a Medicare supplement. Typically what we see with people with the VA is they do have a really good program for the drugs, so a lot of people don't get anything extra for their drugs, but they get an Advantage plan or a supplement so that they can go to outside doctors and have capped out-of-pocket or limited out-of-pocket. Medicare Supplement versus Medicare Advantage. So here's kind of just a highlights reel. On one side, we have Medicare Supplement plus prescription drug coverage. This comes with higher premiums because the Medicare Supplements almost always cost more than a Medicare Advantage plan, but no copays. So you have just a $203 deductible with that Plan G, and you don't have any additional copays on there except for prescriptions. You have the freedom to choose your doctor and hospital, pretty much anybody in the country as long as they take Medicare. No referrals necessary. You're covered anywhere in the United States, and some routine services are not covered, like dental, vision, and hearing. Medicare Advantage plan with prescription drug coverage, generally much lower premiums or out-of-pocket costs on the front end, but it does have co-pays and co-insurance up to the maximum out-of-pocket. You are restricted to a network, to various degrees. If it's a PPO, you can go out of the network, but your cost sharing is lower in the network again. You may need referrals for specialists, and this may include extra benefits like dental, vision, hearing, gym memberships, and over-the-counter benefits. Original Medicare only. So with original Medicare only, you have a Part A deductible, just to recap. You have after 60 days, you have additional daily copays. A Part B premium is normally $148.50 a month. The Part B coinsurance is 20%. The Part B excess charges are 15%. The Part B deductible was $203 per calendar year. And then you have all of your prescription charges. So if you just take Medicare by itself, Parts A and B, this is going to be your potential out-of-pocket cost. That's 20% on all Part B covered services, which is surgery, surgeons, anesthesiology, doctor's visits, testing, all of that kind of stuff. And then those excess charges can get you too in certain areas. Original Medicare with Medicare Supplement and prescription drug costs. So you have your Part B premium, which is typically $148.50 a month. Medicare Supplement Plan G premium, which varies normally between $90 and $140 a month, depending on where you are, whether you use tobacco, what your gender is, things like that. This pays 100% of the Medicare approved charges, so you don't have anything else out of pocket except for that Part B deductible, which is once per year. It's $203. You do have a prescription drug plan premium. Again, that ranges from $8 to $80, depending. Most people falling into about a $15 to $20 range. The prescription drug plan deductible, if applicable, and you have copays. So you might have to pay a drug deductible and drug copays as well still. With Medicare Advantage plan with prescription drug coverage, which is what most of the Advantage plans have, they have drug coverage built in. You still pay your Part B premium, which is $148.50, and you have your Medicare Advantage premium, which varies, but normally zero in most parts. And then you have your medical copays and coinsurance percentage until the maximum out-of-pocket is reached. Generally, what we see is about a $6,400 to $7,500 maximum out of pocket, meaning the most you could possibly be out of pocket. It is important to note that statistics show only about 4% of people in the country each year on a Medicare Advantage plan actually reach their maximum out of pocket. So it's a scary number, but in reality, it's not hit very often. Prescription drug plan deductibles, if applicable, and copays for drugs. And then most plans will offer the extra benefits, routine, comprehensive dental, vision, hearing, silver sneakers, and over-the-counter benefits. Those can be enticing for sure, especially the dental and vision and hearing. So a couple of things we didn't talk about. One is a hospital indemnity plan. Some people that get a Medicare Advantage plan will also get a hospital indemnity plan to pay or to come in and fill some of the larger holes. We see these plans being very beneficial in filling daily hospitalization copays, ambulance copays, potential chemotherapy costs, and wellness visits. so that they can drastically reduce your cost and still save you much money over having to pay for a Medicare supplement premium. Lump sum cancer insurance, we definitely recommend this if possible, because one of the quickest ways we see people hitting catastrophic amounts on their drug coverage is getting diagnosed with cancer and having to take an oral chemo or radiation medication like Revlimid. Those can be upwards of $25,000 a month, and even though your drug plan will pick up 95% of it, 5% of $25,000 a month is a lot. So having a lump sum cancer policy is an affordable way to just kind of insure against you having to cover that yourself. What Medicare doesn't cover, just to recap, we didn't talk about long-term care. So long-term care is not covered. Dental care, dentures, crowns, x-rays, partials, is like your bigger dental care is not covered, or your routine dental care. Routine vision, like exams or getting glasses, is generally not covered. There are some exceptions to that, like once you have cataracts, right after you have the cataract surgery, they will pay for a pair of glasses. But generally ongoing, and for most people, they do not pay for glasses. Hearing aids and exams, they do not pay for. And ancillary products and some Medicare Advantage plans will cover these things. So why choose Bobby Brock Insurance or the Medicare Gurus? Well, first of all, we are a local office, but we realize we may not be local to you, but we do operate like a local office even for our members that are further away from us here in Tupelo. We're beginning to have offices in a lot of different areas, but we like to treat our clients like they're actual local clients that can come see us even if they can't. In these days with a lot of the sickness and scare that's out there, people are not wanting to go out as often. And we completely understand that. So we're constantly adding to our staff so that we can serve our clients over the phone very well. And we'll always answer the phone. When you call in, you have a person answering who is alive and not some sort of answering service or an automated message. We think that goes a long way. We offer all of the available Medicare plans in the state. We proudly represent all of the different companies. So we have every company that will allow us to work with them, and we don't cost any extra. So when you use us, the plan doesn't cost extra because of our services. The companies look at us like a form of advertising, so they have a commission that's built in that whether you called them directly or used us, you would pay the same thing. We shop your Medicare and prescription plans to ensure you are paying the lowest price available for the upcoming year. We are very accessible. You have our office phone and email address. We also have a very helpful administrative team or client services team willing to help with everyone's individual needs. You get experienced agents. We have helped thousands of people make educated Medicare decisions. We work for you, not the insurance company. We hold no bias to any one insurance company. So here's our contact information as well, 662-844-3300. You can view our website at bobbybrockinsurance.com. You could visit us locally if you're local to us. And you can also schedule, if you're watching this online, you can typically schedule through our Calendly link below, or a link to our calendar, a time to meet with one of our senior agents. So you could go down there, pick a time, and then get on our calendar. If for some reason that calendar link is working, please give us a call at 662-844-3300 and check us out. One last thing, I did write this book called Medicare Breakdown. And so if you're a reader and you want to kind of read, or you would like a copy of this slideshow, we can send it to you. You can call our office and ask for a copy of this book. You can check out on Amazon. If you don't want to call anybody and deal with us that way, you can buy this book on Amazon. Just look up Medicare Breakdown. And we're so happy that you took the time to watch this today. We really hope it helps. We'll talk to you soon.